All right, so now we're moving over to the meningioma. So what's going to happen if we biopsy a meningioma? We will classically see these psammoma bodies, okay? So we'll talk about this in just a second. Let's just go through our list here. All right, so the origin is going to be arachnoid cells. So again, not necessarily from glial tissue. The severity, again, benign, just like your oligodendromas and most of your acoustic neuromas, very slow growing in general. And the classic region, like we said, with the oligodendromas, they could be in different regions of the brain, but they usually ask about the frontal lobe. With meningiomas, it's kind of the same thing. They could be in a few different regions. They're usually in proximity to dural reflections, like the foramen magnum, the falx cerebrae. These are very classic areas, but the big area to remember, the number one area, is the parasagittal region. And that's usually going to be right up in this region. When you see a tumor up here, let me blow this up. So when you see a tumor way up here, it almost looks, you can see this tumor it looks like it's coming off of the dural tissues here. Specifically, this is going to be originating from the arachnoid. But you can see it looks like it's coming off of the dural projections here. Okay, and then it's pushing down on the brain. So it's not originating from inside the brain. It's coming from out here. And so when you see that, when you see a tumor that looks like it's on the periphery, kind of originating on the periphery, that's going to be very classic for a meningioma, particularly if it's in this parasagittal region up here. So another term that's sometimes used for this is extraaxial tumors. So again, these kind of questions can evolve into a question where they're testing you on your knowledge of a specific area of the brain. So, if this thing was pushing on the parietal lobe, they might be testing you on certain deficits the patient can have. Maybe it's pushing on the primary somatosensory cortex, for example. You might get contralateral sensory loss in the limbs, or maybe, it's in the dominant hemisphere or the non-dominant hemisphere, right? Because there's all different findings. If it's in the non-dominant hemisphere of the brain, then what would be the classic parietal lobe pathology? It would be contralateral hemineglect, for example. So these are all the things that you just have to think about. And like I said, we talked about, all of the different regions of the brain and what you would expect to find in those regions in another video, but just keep that in mind. Now, the classic microscopic finding here is going to be these psammoma bodies. And these classically are described with having a whorled appearance, okay, kind of like an onion. And I know we've used this kind of onion layer description before, I think when we talked about the Pacinian corpuscles. But again, it's the same concept here with these psammoma bodies. Now, the thing about psammoma bodies is they're actually in a lot of different tumors. So it's particularly high yield to know which other tumors have the psammoma bodies in them. Okay, and we're not going to go through them all here, but a big one to remember is going to be your papillary thyroid carcinoma. Okay, this is a very high yield one to remember that's associated with the psammoma bodies. Okay, and you can also see this with papillary serous carcinoma of the ovary or endometrium, mesothelioma. But the two big ones, if I had to remember two for psammoma bodies, I would remember papillary thyroid cancer and meningiomas. Now again, meningiomas are negative for GFAP and synaptophysin. Okay, we talked about that earlier. And a lot of these cases can be completely incidental. So the patients, might not have any symptoms, and maybe they're getting their brain scanned for some other reason, and they find a meningioma. Very slow growing. And these patients can also present with your classic kind of non-specific symptoms as well. And I do want to show you on here, you can see there's a lot of this kind of whorled appearance going on here that I talked about initially. So if you see a psammoma body, especially in conjunction with this whorled appearance, that's definitely going to push you in the direction of meningioma. But just in general, just get a feel for what this looks like. It kind of has this whirling appearance to a lot of the cells, and that's very classic for meningiomas.